Welcome to Beyond the White Coat. I'm Kerry Briggs. This is my channel. I am a practicing physician assistant for almost 7 years. So, what we're going to talk about today is joint steroid injections and some alternatives. So, before we get started, the information on this site is for educational purposes only and the opinion of the author and other sources. This is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician for any questions regarding any medical condition. So, here we go. I was asked by one of my viewers to discuss knee joint injections with corticosteroids. So, yeah, we're going to take a look at what kind of steroids are used, why they do the injections, the pros and cons of the injection, and we're going to also look at some alternatives to steroid injections. However, that list is very limited. So here you go, Chris, and anyone else who has joint problems. The reason for joint corticosteroid injections are inflammatory arthritis for treatment of symptoms if a person has rheumatoid arthritis, psoriatic arthritis, or gouty arthritis. It's also for osteoarthritis, which is I was young and dumb and did lots of things, and now my joints are hurting because of those things I did. But it can reduce the pain from cartilage wear and joint degeneration. Bursitis. Bursitis, at various locations in our body, we have what's called a bursa sac, and they can get inflamed and swell up. What a bursa sac does is it actually helps the muscles and tendons work more efficiently. So I like to use the analogy, if I could lift 5 pounds with the bursa sac making everything work better, more efficiently, I can lift 15 pounds. I have no idea of those numbers. But it just makes the muscle joints, tendons, ligaments, and all work much better. But they can become inflamed, so sometimes they inject those to cut down on the inflammation. Tendonitis, to relieve inflammation along the tendons. Overuse injuries or chronic pain. So this is to manage such things like tennis elbow, carpal tunnel syndrome, trigger finger, which is a tendon that has decided to curl up, and they can sometimes inject those, get them to release. So you've overused your tendons and that used to be a diagnosis that we used to use was overuse syndrome, but you can't use that anymore. You have to be more definitive in your diagnoses, because I guess that's important. So then there's acute joint injury or trauma, which then the injections help to reduce swelling and pain and hopefully get you back to recover. So these injections are commonly administered in the knees, shoulders, hips, wrists, elbows, ankles, spine, and a lot of times they're used to avoid or move the time frame back of a joint replacement. So usually these are done by orthopedics. Some other providers who are experienced in them will do those injections. I know family practice doctors who do them, and it just depends on their training, their comfortability in doing those injections. So many times, if not all of the time, they want to have some kind of imaging before they do any injections to see if there's any other issues that need to be addressed versus just going in and injecting a joint. And this could be anywhere from just a plain x-ray, make sure there's not a fracture, or it could be even more extensive for a CT or maybe even an MRI to look for tissue damage to ruptured or torn tendons or ligaments. So especially if it's acute, does it involve a fracture or a rupture? You need to know that before you go injecting, because it may need to be addressed in a whole different avenue. It is not recommended that you get an injection in a joint if you have a bone fracture, as it will delay the healing of the bone. And we'll talk about that a little bit more even. So if it delays the healing of the bone, then if it's a partially ruptured tendon, it's also going to delay the healing of the tendon or the ligament. You just need to know that. So the benefit is that with the pain relief, that you can move the joint and possibly even get to physical therapy, that they can work on the healing process depending on the cause, and maybe even get to the point of healing the muscles around the joint in order that you get more stabilization in the joint and don't have that issue any longer. So commonly used corticosteroids in joint ejections, one is triamcinolone acetonate, which is Kenalog. It's highly common to be used, and it's often used in shoulders, hands, wrists, and it generally has a longer acting effects. Then there's methylprednisolone acetate, and it's frequently used in large joints. There's betamethasone, celestone, that is a potent, very long-acting steroid, but it also sometimes will be fast-acting when they add it to steroids together. But the betamethasone is a very long-acting. Then there's dexamethasone. It is a fast-acting, but it is a soluble steroid for quicker use. So it will take effect very quickly, but it has a shorter life on the other end. And then there's hydrocortisone, which was used to reduce swelling, although it is less common than these newer steroids. So the key aspects for steroid injection, one is to manage the inflammation that it can be caused by, like, osteoarthritis, rheumatoid arthritis, gout, tendonitis. Mechanism is that it acts to reduce in and around the joint, which then reduces the pain and improves function. Combination therapy, it's often combined with local anesthetics like lidocaine or bupivacaine to provide immediate pain relief until the steroid kicks in. And the duration, we talked about this a little bit. It's the less soluble the steroid, the longer it will last. The more soluble steroids will work quick, but they won't last as long. They're sprinters, not marathoners. So other non-steroid injections include hyaluronic acid, which is a gel injection for lubrication, and PRP, platelet-rich plasma injections for healing. We'll discuss those later on. You probably never heard of those. So some of the side effects of steroids, and I only looked at basically 2 steroids. I looked at prednisone and triamcinolone. And I'm going to go through the side effects, and there's common side effects. There are side effects that are frequently not or the frequency of those side effects are not reported. We talked about that in the past, that once they get past the trials of the medication, then they kind of stop recording or researching data, and the frequency not reported is what generally comes from the physician or the provider who is actually sending this information back. Hey, I had a patient that did this. So we're going to look at the common short, but we're also going to look at long-acting or long-term use of steroids, some of the side effects, because it can make a difference. So some of the side effects are insomnia, like some people don't sleep. My wife had to take it once for poison ivy and like didn't sleep for 5 days. Good times. Mood swings. And I've had people that come in and going to put them on prednisone for some reason, and they're like, no, I don't want that because I want to kill everybody I'm around. So it can be anything from just really irritable to really like, no, I want to kill people, so I'm not going to do that. And that's a good thing to know. It increases your appetite, and it also increases your water retention. Those will both resolve once the steroid is diminishing in your system. And there is a caution if you're in your first trimester of pregnancy, and your doctor or provider needs to weigh the benefit versus the risk. The risk in the first trimester is the possibility of oral facial cleft palate. So that's something that you need to know about, and your provider should talk to you about, and then you have to together decide yeah or nah. So it can also cause blurred vision, dizziness, fainting, a fast, irregular pounding heart rate, an increase in thirst and urination, irritability we talked about, also tiredness and weakness, but it can also cause a decrease in urine output. It can cause some numbness and tingling in extremities. It can cause trouble thinking and processing information, speaking or walking, and even reported to have trouble breathing at rest. So those are some common ones, some frequently not reported, or the frequency is not, it's not frequently not reported. It's the frequency of these they don't have recorded. It's like how many people have this. Cardiovascular. It's been reported patients have had CHF, congestive heart failure. They've had rapid heart rates, and they've had slow heart rates. They've had cardiac arrhythmias, which is unusual beats of the heart, and they've had cardiovascular or cardiac arrest. And again, there's no, will this happen to you or someone? There's no frequency reported on that. Abdominal pain, constipation, diarrhea, bloody tarry stools, because it can cause a peptic ulcer, pancreatitis, has been known to even cause seizures. A lot of people have headaches. It can increase hair growth and cause thinning of hair. It can change your menstrual cycle, and it can and usually does increase your blood glucose. So if you're a diabetic, you have to be well managed and be able to manage your ups and downs. So some long-term side effects from steroids in general is arthalgia, which is joint pain. Well, aren't we getting these injections because of the joint pain? Aseptic necrosis of the femoral or humeral head. That is your hip and your shoulder, that can actually, the bone can die. Now these, again, the frequency of these are not really mentioned, but they have to put down any and all side effects that they feel is coming from those medications. So it can cause increased risk of fractures due to the thinning of the bone, osteopenia, in long-term use specifically, loss of muscle mass, and muscle weakness, and muscle pain, and osteopenia, like we already discussed. And because of the thinning of bones and that, you can have fractures of long bones. You know, you fall and you break a leg or you break an arm. It's much easier for that to happen. You can have tendon ruptures, and particularly the Achilles tendon, which is what makes your foot work. You can have vertebral compression fractures. This usually happens with thinning of the bone, and a person, usually older, falls and they compress the vertebrae in their back. And in pediatric patients, long-term use can suppress their growth. So these are just some highlights of the side effects that have been seen and noted with this, and this is not an extensive list. This is what I felt was most important, wanted to share, but there are others. And if you go to drugs.com and you put in prednisone or you put in Kenalog, it will give you the whole, all of them. I guarantee your doctor doesn't know all of them. But you need to take your own health and what is happening to you serious enough that you do some investigating on your own anyhow. So pros and cons of the joint injections. Pros: you get rapid pain relief from steroid injections. And this is for most people. There are some people that it has failed, but for most people, they get pretty fast relief from the pain and localized reduction of the inflammation and the severe pain so that they can function. It improves the function and mobility of that joint and allows a person to go back to the normal daily activities and hopefully also do some PT to try and strengthen the muscles that support that joint. It's targeted treatment. It delivers the medication to the affected area, and it minimizes the systematic effect of that medication to the rest of the body. What does that mean? That means you're injecting it into, let's say, a knee. You inject it in there. Most of it stays confined to the knee. There is some leakage of that, and so there is some systematic effect, but it's not like if you take oral medication, that's going everywhere. They haven't figured out a pill that go and fix my left bicep. That doesn't exist. If you take a pill, it's going everywhere. And you knew that. So another pro is that it's an alternative to surgery. It can temporarily manage the symptoms, particularly the pain, and delay the need for a joint replacement. So yeah, if you're young, they're going to try and do stuff like this to get you to that point where you are more of the right age. And the reason is let's say you're going to have a knee. So a knee will last 10 to 15 years. I've known people that's had theirs 20, but then has to be repeated. Well, if you're in your 40s, that means somewhere like 55 or 60, they're going to have to replace that replacement. So they try to get people farther down the years to minimize the repeat surgeries. So cons of the steroid injections, its relief is temporarily. It only lasts for a few weeks to several months, and then has to be repeated. A lot of times it's like every 3 months people are getting injections. If you get an injection and you get little or no relief at all, or it only lasts a short amount of time, then you need to get back to that provider and tell them that, so that they can look for other causes other than just inflammation. Potential cartilage damage. Frequent and long-term use can accelerate cartilage breakdown and further damage to the joint. It weakens tendons. We talked about this. Repeated injections can weaken the tendons, which makes them more prone to rupture. And there's evidence of bone thinning, osteopenia, which can lead to bone fractures. Another con of steroid injections is post-injection flare. It temporarily increases the pain and swelling that occurs after 1 or 2 days from the injection. And if that happens, then you definitely need to contact your provider who stuck a needle in your joint and let them know so that they can re-examine you or give you more information. And then the symptomatic side effects. It temporarily increases your blood sugar significantly if a patient is diabetic, thinning of skin, In particular, you see this in older people who are chronically on steroids for COPD or arthritis, that their skin is very thin, and they'll come in with skin tears all the time. And you can get a localized pigment change can occur. I had a friend who had tennis elbow injection, and then our hands, our arms hang down, and so he had a streak down the one aspect of his arm where the injection had migrated down, and it was self-limiting, but that can happen. And then it can also raise your blood pressure. So today, one of the main issues that we have is we don't like pain. Give me a pill, take it away. Make it go away, and make it go away yesterday. But actually, pain is a wonderful / yet hated thing. Pain tells us not to do certain things, like touch a hot surface and leave our hand on that, to stab ourselves repeatedly with a knife. It keeps us from cutting fingers off, and keeps us from doing those kinds of things because we know it's going to hurt. And so you don't do it. So pain is a necessary thing. And so if you have a joint that hurts or something that's hurting, your body is talking to you. Please listen. And it tells you not to do certain things, like your left knee hurts. Okay, so I'm not going to do knee bends or bend down on that because of pain, which can then possibly cause more damage to the knee. So the issue is that it also stops us from what we need to do. That pain stops us from doing what we need to do, like work. I need to go to work. Oh, I can't. My knee's killing me, and that. So it can get you back to that. So joint injections of corticosteroids can get you back to your daily living, but it does not help other than stopping the immediate pain and dealing with the inflammation. An injection can take hours to days to take effect, and then there's certain people, I've had people that said, yeah, I got injected a week ago, and I never felt anything. It's not changed my pain whatsoever. And if you're one of those people, then you need to again get back to ortho or who did the injection, and to get further examination and maybe further imaging to find out what the real issue is. So injection of steroids it does nothing towards healing, other than it gets rid of the inflammation. The only way that it does help with healing is if the pain goes away and you can get to like physical therapy and you can strengthen the muscles around the joint, and then not have a stable joint where you no longer need the injections, then that's helpful. There are multiple studies that have shown that injections over time, and usually they limit it to 3 or 4 injections per year, can actually weaken the tendons and ligaments, which makes them susceptible to rupture. So if you can get to physical therapy or get the condition under control, then certainly the injections may be worth it. But if you can't get that under control, then you got to know that other things are happening inside your body. You need to address the underlying problem. And in some cases, let's be honest, you're just delaying the inevitable of a joint replacement. It's just the nature of the game. So steroids are an immunosuppressive drug, which immunosuppressing, which means your immune system's not working, so it's going to delay the healing of the joint, the tendon, but it will also delay if you have any other kind of infection. So steroids are kind of a double-edged sword. It may give you some, not instant, but some real soon relief, but that may only be temporarily and may need to be repeated, and it may be causing more or other damage long term. So alternatives are two. One is called PRP, platelet-rich plasma injections, and the other is hyaluronic acid injections. So a PRP, a platelet-rich plasma, is that they draw some of your blood, they spin it down, they take the platelets out of there and the plasma, put it in, and they inject it, usually by imaging, most of the time with like ultrasound and guided, and then the platelets in that area, then it sparks healing, and it starts the healing process to whatever is the cause of the pain in that joint. So it's limited on if things are torn, it can help repair it, but it's not going to be like you're injected with a steroid. It's not going to be an immediate relief like that. It's going to be over several days to several weeks. But the difference is that, unlike the steroids, this is actually helping to heal whatever the issue is. And that has to be decided by, whoever's doing the injections. Will this work? Will this help heal this, or is it just not like too late or whatever? So it's longer to take effect, and you don't get the immediate effect of like you do with steroids, but you're getting a longer effect of getting some healing, and you don't have the side effects that steroids come with them. So you're heading down the path of healing the area, not just masking the symptoms that steroids do. Some issues with this. It's going to be dependent on what the cause is, one. The other is some insurance companies do not pay for this. And the average cost is anywhere from, and this is a wide range, $250 to $2,500, with the average being about $1,000. So this injection can last anywhere from 9 months to 2 years. So depending on the cause, depending on your situation, it may need to be repeated in 9 months. Sometimes there's cases where they've actually had to have multiple injections to get that going. So it's all dependent on the cause, orthopedics, and if they feel that would benefit the patient. There are very few side effects. The side effects have to do mostly with the injection site, infection, bruising, that kind of thing. So hyaluronic, for some reason I want to pronounce this different. I'm not going to say it because then I'll pronounce it that way. Hyaluronic acid. This involves injecting a gel-like substance that is glucose-based, similar to the natural joint fluid. It's put directly into the joint, and most commonly it's used in the knee to relieve the pain and improve movement from osteoarthritis by acting as a lubricant and a shock absorber in the joint. So it's kind of like your normal joint fluid, and so they're just kind of like replenishing that, putting that back in there, and you can get some relief from it. But unfortunately, this has to be repeated over and over, because eventually the fluid will thin out and not become effective anymore, and then has to be repeated. And again, very few side effects. Most of it has to do with the injection sites. So points to take away from this: steroid injections, although the mainstay, they can come with some side effects, and you need to be aware of and know what they are. And you need to weigh the benefit of the steroid injection versus the side effects. And if used, can you get to the root cause to solve whatever's causing the joint pain and fix that? Or are you just delaying the inevitable of down the road I'm going to have a replacement, joint replacement? Number two, does your insurance cover a PRP injection, and will they help heal the cause of your joint pain? And again, that's between your orthopedic doctor and you. Hyaluronic acid is temporary, but it doesn't have any side effects other than the joint, but it has to be repeated over and over again. So all this is dependent on the cause, what your orthopedic doctor feels would benefit you the most, and what is appropriate for your situation. So that's why you need to get, if you have joint issues, to a good orthopedic doc, and you have some weapons here you can discuss with them and try and figure out what to do. Again, I hope this has been helpful. If you like this site, click like. Share this with others, and if you, it's posted on Facebook. So if you, as well as YouTube, but if you have comments in the posting after the posting, then just shoot me a message, and we will continue.